New at 6:30, Election Day exit polls show only a small percentage of voters said the coronavirus pandemic was a deciding factor in how they cast their ballots.
So with that in mind, will that change how the public health field tries to bring the pandemic under control? Here is KDKA health editor Dr. Maria Simbra.
The closeness of the election has raised the question for the public health field. Where does it go from here?
We're not trying to change political beliefs. We're trying to keep people from dying.
In the primary care office, doctors hear how weary people are of the messages to mask, distance, and wash hands.
I'm finding that in my practice. People are so tired. They're so tired and they're so anxious. And it's not just the pandemic, it's the other things going on in our world.
Only 14% of Republican voters in exit polls said the pandemic was a deciding factor, whereas 82% of Democrat voters said the pandemic was the top issue.
This sort of disparate philosophies is not helping. Those kinds of numbers also reflect that people have other concerns and other beliefs and other motivations.
What doesn't work is harping at people.
Why can't you just be smarter and listen to us and believe us and do what we say to do? I mean, that doesn't help in anything that we're trying to accomplish.
One new direction to pivot would be partnering with people who understand the science and have credibility in reluctant groups. Another idea, listening sessions with skeptics and asking them to brainstorm solutions.
Maybe finding people within communities that you're trying to reach, that you can forge a connection with, who may have more trust, in that particular group. I think listening, tell me what your concerns are, what are your perspectives, what are your thoughts? And I want to hear your ideas.
She likens the conversation to the one she has every day with her own patients about getting flu shots and quitting cigarettes.
If I can affect my patients' decision-making and maybe their family and small group of friends, that's a win. I believe that this is not hopeless, either the pandemic or the ability to find some common ground.
A delicate balance when behavior change is slow and fighting the pandemic is urgent. I'm Dr. Maria Simbra, KDKA News.